Hi, I'm Joe Connolly. Here's a business that could be a growing field in a lot of industries. Nomad Health finds part-time jobs for doctors and nurses who don't want to retire and who might like to practice for the winter part-time, say, in Florida or someplace. Meet Alexi Nazem, MD and business owner.
My training, my life up until this point was as a physician. I still am a physician and practice a little bit. And when you're on the front lines every day, you recognize all the things that don't work exactly perfectly. And this particular issue that we're working on at Nomad, which is trying to help the United States with its physician and nursing shortage, was something that I experienced day to day, and that my co-founders experienced day to day. I founded the company with a couple of other doctors, and together we spotted this opportunity where we recognize that there's this shortage, but the way that it is being filled today is totally frustrating for everybody involved. Simply put, there is a brokerage-based system to find extra, temp workers, temp doctors, temp nurses, and all of us, my co-founders and I, just kept getting phone calls, emails, pages, mailers in our post office boxes, and it was
offering you new jobs?
New jobs, temporary jobs, and I had to put my phone away because the call that I just got was actually from one of these agency brokers. They are just relentless, and so we saw that this was not only a frustration, but also an opportunity to fix a problem.
A need. So you saw the need before the opportunity.
Mm-hmm.
Then what did you all do? Get together and say, how can we cash in on this? Or, then what happened?
So, to be honest, as doctors, we don't really think about the financial opportunity, although there is a great financial opportunity here. But two of my co-founders are surgeons up in Connecticut, and they approached our other co-founder, who is a serial technology entrepreneur. His name's Kevin Ryan, founded a number of great companies that probably most of us interact with on a day-to-day basis, Guild Group and Business Insider and a couple of others. And he's someone who recognized the way that technology can improve, in fact, completely change outdated industries. And so bringing him on board also was a way to actually start addressing the challenge, the solution. So we were solution-focused first, and then realized that there was a big business opportunity there too.
And the solution that occurred to you was to turn all these solicitation calls upside down, right? And now we'll say, hey, I bid to work this job.
Yeah, so I think the key thing here is that we wanted to eliminate the middleman, which is the staffing agency broker. So today, if a hospital needs an emergency room doctor for a month, for example, if they want to find that doctor, they have to go to a staffing agency broker. And if the doctor wants to do a little extra work, they have to go to that staffing agency broker. And just like any brokered business, that creates a sort of an inefficiency. It's expensive, it's slow, it's a variety of things that are just not great for that transaction. And so what we did is we said, let's remove the broker and replace the broker with technology. And so we created an online platform, a marketplace where the doctors and hospitals, for example, could find each other directly and transact directly, and also in a totally transparent way, which is not how the broker-based market works. It's a very opaque market when the broker is involved.
But isn't a big part of this, though, that this is being run by doctors for doctors?
Yes.
Doesn't that make a huge difference to your users?
I hope so.
Right.
I think that the needs and wants and desires of the doctor were often, and of the clinician, so it's doctors, nurses, and other types of clinicians, they were often lost in translation here. And so, like I said before, we were getting bombarded with phone calls and emails, and that's just not a great way to live, but it's also not efficient for the hospitals that's trying to hire us. So yes, by refocusing this system around one of its key customers, the doctor, I think we've landed on a better mousetrap.
Who are the doctors and clinicians who are using you, and why? Do they want extra work or less work or more work? What are they using your service for, Nomad?
Yeah, that's a great question, actually. And the reasons that people use Nomad and the types of people that use Nomad are quite different, but there's a couple of big groups. One big group is doctors who are right out of their residency training. So they're young, they're hungry, probably have a lot of debt, so they want a little extra money to pay down their debt, maybe to buy a house, start a family. So that is a really big group of people. The other group of people that we see a lot of are doctors nearing retirement. So doctors are drawn to this profession because they love it. They feel this sense of service, and so they never want to give it up. But it does get hard to keep practicing 80, 90, 100 hours a week. And so doing this kind of work, temporary freelance work through Nomad, affords an opportunity to do a little bit less but still keep a hand in the game. So those are two of the big groups that we see on the platform.
You could almost start a service for people who want to continue at a slower pace in almost any industry. That's almost a universal professional dream.